The nature of medicine is that we tend to see complex cases that come through our door, right? And oftentimes people will say that we have so many different things. What thing do you address first? Hi, I'm Dr. Joyce Knieff. I'm a naturopathic doctor, and
I'm Dr. Jordan Knieff, also a naturopathic doctor.
yeah. So, well, I figured we'd do a fun little exercise today for our interview. First, and how would you move through this case if we had a, say, 50-year-old woman coming in, just diagnosed with diabetes? She's very distraught about this. A history of high blood pressure. Maybe her parents had high blood pressure too, and heart conditions. She has knee pain and hip pain, so she can't walk or anything like that. What would you do for her to start out? And she's really distraught that she has diabetes.
Yeah, I mean, it's definitely complex. The first thing to always do is foundations of health, right? So just taking a good close look at what her diet looks like currently and areas that can improve relatively easily for her is most of the time not radical change. Already for that, a lot of people need more gradual changes.
Yeah.
So in terms of diabetes, that's just what do the macros look like in her diet? So carbs, fats, proteins, and getting those in balance, more aligned with what her goals are. Looking at what activities she is able to do during the day, in terms of it was walking hers, but is she able to do swimming, biking, other things like that, less impact, that still allows her to get her heart rate up, do some of those things, figuring out why she has those pains in the first place and addressing some of those obstacles so that we can get her moving. Just because in terms of diabetes, there's lots of drugs, there's lots of herbs, there's things that we can throw at people, but diet and exercise really still are the foundations of not just managing blood sugar now, but really having good blood sugar control going forward through life. So when we talk about truly reversing or curing diabetes, which is its own debate topic, right? But really what we're talking about is getting people to a point where they can manage their blood sugar on their own without any additional medications or supplements, and without being draconian or unreasonable about the amount of exercise or diet they're following. Living and enjoying life and having good blood sugar control again.
Right. So what if I were to bring that theory down back to earth here? So what if this 50-year-old woman, let's just call her Susan. I don't know, that's a name that just I pulled out. So Susan is probably taking care of her husband. Okay? So Susan is really busy taking care of her husband. They both work, and her husband comes home and just kind of sits on the couch, and she doesn't want to cook because she's so tired after a long day of work that they usually end up ordering takeout, and maybe she doesn't really know how to cook, and she is so tired after work that she doesn't really have the time to go exercise. This is the reality for a lot of American people.
Yeah.
So when it comes to a picture like this, I know it's really easy to say, well, just eat well and exercise, but for a lot of people it can be really difficult. If that is the case, then how do you approach that?
Yeah, like I was saying, we always kind of address those foundational pieces first. See where people are at, see what easy changes can be made. And then in terms of getting everything else managed faster while she's working on making those kind of deeper lifestyle changes. Usually start with a pretty good foundation of herbal support and nutritional supports for people.
So maybe she feels less stressed out.
So feeling less stressed, feeling like she is doing something, getting to see those numbers kind of come back into a healthier place. Bitter melon is a really incredible herb that works really well for a lot of people.
Yeah.
It helps resensitize them to insulin, which is the whole name of the game for diabetes care, right? If we can get them sensitive to their insulin, then they'll have better control of their own blood sugar.
Yeah.
And so that's usually where I start with a lot of diabetic patients who come in, just because it works well, it's gentle, most people don't react to it in any negative ways that I've seen. There's a lot of nutritional supports so that people can be lacking magnesium, B vitamins sometimes, depending on their diet. So kind of in this case where they're relying a lot on kind of fast food, convenience food, things like that, the diet's probably lacking a lot of things. And so giving the supplemental support of a really well-rounded multivitamin, maybe a fiber supplement to take couple times a day or around meals to artificially put those supports in place until she can get the diet in better place.
Oh, got it.
And get the blood sugar managed, but also kind of show this is where we need to be. Or you getting 10 or 15 grams of fiber with your meal, and you would like to not drink this fiber shake. So
inherently motivating.
where can we start making these changes so that not having to spend money on the supplements, not having to drink really thick water, not having to necessarily rely on a multivitamin, or at least not as intensive of a multivitamin.
So kind of using supplements to bridge the gap of where she currently is at and motivating her towards like, if you want to change your diet to include more fiber, include more nutrients, then you can move towards this and then move away from the supplements. But having the supplements sort of be there to control her blood sugar in the immediate stage.
Yeah. And that's usually where I start with people, kind of see how do they respond if they have a continuous glucose monitor or a CGM. Then we can see kind of in real time over the next like month or so how their blood sugar is responding to changes. Otherwise, checking A1C kind of after 3 months. Depending on their history, we do sometimes do some additional testing. It's really easy to blame people for diabetes as just being their fault because they're lazy, they're not eating well, etc. Right? But we know that there's a lot of moving parts to health in general, but especially blood sugar control. Things like chronic stress and cortisol levels, both high or low, can really throw off blood sugar control. Exposure to things like heavy metals, other environmental toxins, things like that. So what does she do for work? What does she do for hobbies? What does her husband do for hobbies or work? Right? Seeing if there's exposure risk there. Mold is a big one that we keep seeing more and more of.
Yeah, gosh, like maybe Susan not only takes care of her husband, but her husband is into welding. And she's high stress, so she's taking care of her husband and going into her 50s. She's probably perimenopausal too.
Yeah, hormone balance, GI health, which again, if she's relying on a lot of fast food, convenient food, things like that, her microbiome is probably not in the healthiest place that it could be.
Got it.
She's not eating a lot of fiber. She's not feeding a lot of the good bacteria that we want to grow.
What does microbiome have to do with blood pressure and blood sugar, I guess?
I didn't even touch on blood pressure yet. Yeah, so the microbiome is really cool because it interfaces with a lot of things that people don't necessarily think about. So one of the big drugs that's like cool and hip right now is the GLP-1 agonist. And the GLP-1 system in the body is regulated in large part by the microbiome. And so if people have a lot of dysbiosis, so like the wrong bacteria kind of growing or too much bacteria growing, it can throw that system off, and that can mess with satiety and body-wide inflammation, stress signaling on more just chemical level, nutrient absorption and utilization. There's all kinds of things that can go wrong if the microbiome is off. We see that a lot with people. Just there's some really good GI work we can do to help get blood sugar more managed quickly, and also help kind of all these other things in health, which kind of circles us over to the blood pressure side of this question, right? Which blood pressure happens for all kinds of reasons. A lot of times it's not worked up well. People get their blood pressure checked and say, oh, your blood pressure is high, here's a diuretic. If that doesn't work, we'll move on to an ACE inhibitor or an ARB. If that doesn't work, we'll move on to a beta blocker, a calcium channel blocker, and kind of just escalating without really looking into why their blood pressure is as high as it is, right? And so blood pressure can be off for a lot of reasons. I think for most Americans, probably at least a large contributor to that is just stress and what we call peripheral resistance. So the blood vessels in the periphery of the body being kind of anything that's not the core, right, constrict. They're smaller too, but the person still has the same amount of blood, and so the pressure goes up, right?
Smaller tube, same volume, pressure goes up.
And so
physics.
And so the name of the game then is to just get their blood vessels to relax, right? There are medications that do that. There are herbs that do that. Sometimes just having people do breath work and restructuring their life bit by bit in a way that eases some of the stresses and burdens on them.
Yeah.
Exercising more will help with that.
An entire point of diuretics is to decrease the volume, right?
Right. And so we usually are doing additional workup with blood pressure unless there's something kind of obvious kind of staring at us of like, okay, you have a high blood pressure and it's super severe and you have all these things. Maybe these are some of the culprits. Let's not dig into that versus someone whose blood pressure is just kind of mildly elevated. They're super stressed out. They're not eating well. They're not moving. They probably don't need medication or even herbal support. They just need to get those foundational pieces in place. And sometimes the herbs will help
get them there.
Get the blood pressure down while we're working on all that. And then once they have those routines in place, we can pull that support back. And again, kind of have them managing on their own.
Yeah, and this is like a major tenet in naturopathic medicine, right? Where we're not only treating the root cause, we're also treating the person, which I think these two concepts often get conflated to each other. But like to treat the person is to meet the person where they're at. So sometimes people will need supplements before they are able to make lifestyle changes. And some people can just make the lifestyle changes and maybe need supplements later on. And it really depends on the person. And in that way, we're treating the person towards their root cause, right? Yeah, maybe next time we can talk a little bit about hormones, because that is a huge topic.
It's its own topic.
It has to be its own topic. There's so many pieces to hormones. All right, thanks for tuning in. I know this is a short one, but see you guys soon.
Yep.
Drop any questions in the comments.